Health Committee of Parliament has promised to give priority to peculiar cases of health facilities that are in a state in Kigezi region during the budgeting process for the 2024-2025 financial year. Led by the Kabale Municipality Member of Parliament, Dr Nicholas Kamara, the MPs were this week in Kigezi region to ascertain the general performance of the health sector. According to Dr Kamara, the MPs were particularly concerned with the health sector performance budget, delivery of medicines, the performance of the ongoing infrastructure projects in the health sector, functionality and performance of hospitals and health center floors, and functionality of theatre and maternity wards, blood transfusion and human resource, among others.
The sector budgets, performance, we'd like to know about the delivery of medicines, we'd like to know about the performing of the ongoing infrastructure projects, and we want to ascertain the functionality and performance of health center floors and hospitals, especially hospitals where we are very interested in health center floors. When to go to health center IVs, our mandate somehow does not, we are not mandated to supervise health center IVs. And if the DHO could also make a note about theatre functionality, maternity functionality, blood transfusion, human resource, water and power. No power is a problem, but we are working towards solving that problem. I think we shall have done our duty, and then we shall make a report, and then we start the budget process. As you know, it has started. We budget.
In the Kabale district, the MPs were able to inspect Kabale Regional Referral Hospital, Kamukira Health Center 4, both in Kabale Municipality, and Kakoma Health Center 4 in Kitumba, among others. Speaking after the visit, Dr Kamara noted that there are healthy facilities that are overwhelmed with a number of patients, which are underfunded because of being deemed to have a small catchment area, and those that are operating in a sorry state. Such, he said, that will be given priority during the budgeting process for the next financial year.
Funded and unfunded. This one has always come on top of the unfunded priorities of Ministry of Health. They usually put it in the ministerial policy statement. We pick it, but you know, resources. Everyone wants resources. Roads want resources. The agriculture wants resources. PDM wants resources. So we also try our best. But I hope, like some areas, really we can prioritize them. There are some areas where you find that their catchment area is deemed to be small, like in Soro. Busanza is deemed to have a small catchment area. But it attracts Rwandese, it attracts Congolese, okay? Like Kamukira is deemed to have a very small catchment area. But you saw the people who were there. Most of them are not even from Kabale Municipality, okay? So we do this on a case-to-case basis. You cannot say all of the money should be increased across the board. There are some who get money and don't even get patients. So we tend to balance as the health committee and increase money as on a case-to-case basis as it is deemed possible.
The Kabale Chief Administrative Officer, Fred Kaliasura, expressed concern that projects that are being constructed by the UPDF Engineering Brigade have either stalled or have delayed to begin.
Challenges which I want to point out. One, we have projects that are implemented by the engineering brigade. Last financial year we had around 4 projects. They were not all implemented during the financial year. They are being carried forward. And for some of them, like Mazima, construction has started this financial year. They are soon reaching the work rate. But as the auditors come from Office of the Auditor General, they are now next on why we pay the engineering brigade before work is done. Yet the MOU we are tasked to sign with the Ministry of Defense stipulates that we should transfer money to the brigade even before they have started work. So that is a challenge which the committee can help us to address. This financial year we still have projects to be implemented by the brigade, and we are sure it will be the same trend. We've talked to the head of the brigade, and he said we shall talk further after I have received money on whether for some of the sites, the activities were continuing. So he could take on what was for last year and this year, provided we give him money. So the discussions we want to discuss and see whether we can implement some of those this financial year. The other challenges for which he has not talked about for the nature of the terrain here. We have infrastructure that was constructed like in Buramba, the maternity wing, but because of landslides, it is under threat. If we don't put a retaining wall, the soil will burn into the block, and finally, we've written to Ministry of Health several letters, but they have advised that we repurpose the money that they sent for capital development to handle that. When we look at that money, it means we can't do anything else at the other facilities. Actually, this financial year, what we had planned to put some latrines and improve some of the staff houses, but all of it was swept and we put it to construction of a retaining wall at Kakoma.
In response, Dr. Kamara said that the Parliamentary Council has already set up a meeting with the UPDF Engineering Brigade to iron out this problem.
As we came out of this meeting, actually, the Parliamentary Council has advised me that they have already set up a meeting of the Health Committee and the Engineering Brigade of the Army. So in that meeting, we are going to get issues from the people who went to Kanum side and Rukunjiri, and also get our issues and make sure that they are sorted. But the main issue is that the Engineering Brigade of the Army is paid full amount of money before they start work. To me, that is quite unusual. And of course, there are also some projects where they have been paid and they have not started work. How can you fail to work when you have been given full amount of money? Those and other issues, we shall solve them. We shall make sure we solve them, and we get lasting solutions when we meet the Engineering Brigade of the Army together with the Health Committee.